Hello everyone and welcome to FXWB New Beginnings podcast with Michelle. 2025 is coming to an end, but we're still here. And we are here thanking everyone for being a part of FXWB Functional Wellbeing, our summits, taking part in programs, Move with me in Indy. We had fun this year going around town, meeting new people, having our summit that helped a lot of people, join and connect with different expertise, and have a lovely guy sitting down next to me here who we will have a lovely chat with to learn more about what he does and just learn more about how we can all help each other be healthy, live better in 2026. So thank you so much for joining me this day and listening into our podcast today. You're gonna hear a lot from me in the couple of months coming up because we have another summit. We had a summit in October. It was October 19th, and we did a Functional Wellbeing FXWB Mental Health Summit. But we had a combination of various expertise coming alongside each other on a panel discussion to help everyone have an idea of where they can find resources to get help. Not just mentally, but also physically and emotionally and spiritually. So on our panel, we had a chiropractor, and that person is this individual we have sitting here with me today. And he is going to be back in our summit coming up in April 18th. It's a Saturday. We're going to have a long day of enjoying activities for kids, seniors, and women over 35 and families. So we want you all to come on out to join us. We are going to be on the east side of East 21st Street, just at Franklin and Post Road, I think that is. No, Franklin and East 21st Street at the Old Bethel Church. We had our summit there last time, and we look forward to being there in spring to enjoy having you guys there. There's going to be lots of room for a lot of engagement. We are having engagement activities for kids. We are also doing things for our seniors, and we are coming out and teaching people. So we're having short little workshops on different aspects of, for example, senior living. We're looking at things such as functional nutrition, medicine, chiropractic services, pharmacists. So come on out. We would love to have you there to join us at this event, April 18th. So let's switch gears and talk with Dr. Michael Williams. Dr. Michael Williams, he was at the event. He was one of our panelists at the event in October, and he shared a lot of interesting information about chiropractic and our health. So I wanted to get in connection with him again and share some more before we even meet up in April, on April 18th. So Dr. Williams, thank you for joining me.
You're welcome.
All right. So let's hear a little bit about who is Dr. Williams, Dr. Michael Williams, because there are a lot of Michael Williams out there, but Dr. Michael Williams.
Well, I was born in Indiana,
Okay.
Putnam County area, and raised there. I decided to be a chiropractor when I was a freshman in high school.
Okay.
And ended up going to Indiana State University for my undergrad and then National College of Chiropractic for chiropractic college.
Okay.
Outside of Chicago.
All right. Okay. And so, did you do any specific area? Tell us about what is chiropractic. What does that particular field entails?
It's trying to normalize joint mechanics. Basically, 95% of thalamic stimulation comes from joint mechanoreceptors. So if the joints aren't moving, it affects the brain function, and it affects overall function. So the brain's functioning, it sends electricity through the body and out through the spine. If there's a restriction in there or whatever, it will affect organ function, muscle function, things like that. And what chiropractors try to do is restore that.
Right. So it's kind of resetting and restoring the joint in its correct movement.
Correct. And so therefore overall restoring neurological function.
Okay. So if you think of this, guys, now I'm thinking about many different aspects here. Who needs a chiropractor?
Everybody should.
Yes.
I mean, my youngest patient at this point in time is 6 months old.
6 months.
The parents brought him in because they just wanted him checked out.
Yes.
But come to talking with them, they found out that he was only having a bowel movement once a week.
Oh no, we can't do that.
And so...
Not even for adults. We cannot do once a week for adults. So if you're having a problem going to the bathroom, we need to be checked out. All right.
So after my third visit with him, they said that the 3 days afterwards, in between, he had went every day. So we're trying to normalize him to so.
Yes. What can create these types of nuances?
Well, in a baby, birth is one of the most traumatic things they say we ever go through.
Yes.
You know, especially if it goes through the canal. But C-section maybe not so much. But there's so much that doesn't happen when you don't go through the canal, as far as the shocking of life coming back, that kind of thing. So there's some reflexes that are supposed to happen naturally when you are doing the C-section that doesn't happen, and so we can try to help with that with chiropractic care too.
Yes, because as you said that, I'm remembering, for instance, when I'm doing an assessment for a client as a functional nutritionist, we have to look at different triggers. And one of them is, how were you born? And we look at C-section versus natural vaginal birth. And people cannot understand how this affects who you are and what you're going through to this age. And there are many different things can happen to you. Give us about 2 or 3 things you have recognized with someone not being a vaginal birth versus a C-section. What would be 2 things you might think of?
Well, the ones I've seen, they don't seem to be as alert. The babies are more lethargic.
Gotcha.
You know, that kind of thing.
Yes.
It all plays a role in that.
Yeah. And it also plays a role in your digestive system.
Right.
Crazy, right? But if he's saying that you're lethargic, guess what? That same concept is happening with your whole system, all your organs and how they work, and how much they're firing up, and how you actually use your body. So knowing that one can be affected by just their birth is something that we need to learn. And guess what? If going through your whole life you have certain things going on, so like for ladies, we have the big issue of menopause. Now, as I always say, menopause is not just that one-time thing. It's a phase, 4 phases in menopause, and we have so many different things happening to us during these different phases of our lives. But sometimes, especially in perimenopause, we may have problems like constipation, fatigue, stress, and these things have an effect on how our joints work. Some people get rheumatoid arthritis. So speak to us a little bit more about that.
Some of it, you could have an issue with an organ that causes issues with the spine. Correct. And they call that a visceral-somato reflex.
Yes.
Or you can have a problem with the spine that affects the viscera. And so therefore, I've had patients come in that were like horrible periods and stuff like this. I fixed the spine and the periods straightened up.
Right.
You know, and so my receptionist of 30 plus years, her youngest daughter was 1, she was like 16 years old, bad periods, and within six months to a year, she didn't have any problems with periods afterward.
But you can see that there is this correlation.
Correct.
Because it's not just only, we have to remember our body is unique, yes, but it is connected. Everything is connected within us and outside of us, because the environment also plays a part in interrupting our systems. So when you think of a chiropractor, don't just think, oh, he's just moving my bones. It's totally different. It's more than that, much more than that.
Right.
And I want you to share with us some of the things that you do in your practice, because I know there are different types of chiropractors out there. They might not be doing a vast number of modalities, for example, but what are some of the things that you share, and what do you do for your patients?
Well, I do not only chiropractic, but acupuncture. I also do some physical therapy with like StemWave,
yes,
which is a regenerative type medicine, and actually it will stimulate stem cells so that the body will regenerate itself.
Yes, so if you notice behind them, we have a flyer poster board that shows about StemWave treatment, and that's something I want us to kind of tackle a little bit today if we can. And in our summit, we're going to talk a little bit more about the StemWave and chiropractic in general, so that we can learn how we can help ourselves, because hey, we're going to have some seniors out there, and you know what happens when we get older, right? Mobility is an issue. So we want to talk, that is what we're going to talk about, because we are going to have a short workshop presentation, and Dr. Williams is going to talk a little bit more and kind of demonstrate some things if he can, if we could induce him to do so. But you know, we want to really highlight more about what chiropractic can do for kids, seniors, families in general. So tell us a little bit more about the StemWave program.
Well, like I said, it's usually an accumulative thing. So as far as treating a joint, whether it's the knee or hip, or spine, it's something that has to be continued. Even though I've had patients that will feel better after 3 or 4 visits, or even 1 visit, and then drop off and not come back, it doesn't do its full effect until 8 to 12 visits, and then it'll help to stimulate your own body's stem cell production so your body can regenerate itself.
So I'm going to compare that to when I was a chiropractic assistant. When someone comes in, for example, say they got in an accident and we had low back issues or hip issues, what we make sure and do was we had like 3 phases of treatment, which turned out to be about 12 weeks. And every phase, we would increase the workload for the person to be rehabbed and to help them get healthier. Now, the rehab didn't come without the adjustment. You need to be adjusted, because especially in accident cases, you have individuals, their bones shift, and that's what's causing the pain, among other things like the tissues, the ligaments, everything else. They have a lot of things happening, and some people come walk in with migraines, and even though they got their low back hit. So they're all connected. Remember, we said that before. So knowing that you're doing something like the stem cell, for example, StemWave, you want to be able to have a consistency with using this type of modality. So tell me, give me an idea of somebody like came in with a knee issue, or one of your patients. What has been the outcome, or what have you seen as one of the benefits? 2
patients. One is already scheduled for this December for a hip replacement.
Okay.
And she's a nurse out of Terre Haute. And so she was driving in from Terre Haute, and she canceled her hip replacement.
Oh, wow.
And so I had a guy driving up from Bloomington for a hip, that he also had a hip that he was thinking about having it replaced. And unable to even go 90 degrees as far as with the squat. Now, after about 5 visits, he was able to squat all the way down.
Wow.
and he was unable for the last 5 years to lay on that hip, and he's laying on that hip now, sleeping on that hip.
Okay. Well, guys, listen. StemWave. I think I need to help. I need to do it too because my hip always hurts me too. Given that I'm always working out, and I've also had accidents, and I've been an endometriosis person for years of my life. So there's things that you may think, well, okay, I didn't have a hip problem, so what else could this help?
Shoulders.
Yes.
So disc issues in the lower back,
Yes.
or neck, TMJ, so plantar fasciitis,
Okay.
Neuropathy, stuff like
Right.
that. So
Somebody-
diabetic neuropathy.
Okay, somebody with rheumatoid arthritis.
Well, it's going to help with inflammation because it helps reduce inflammation. So.
Good. So it's all about trying to remove inflammation, and that's normally like a number one trigger for people having issues, whether it's arthritis versus an accident. Inflammation is what comes up, and it's something that we all would like to not have because we don't want to have pain. So this is a good way to get an opportunity to use something that can help you live better.
Correct.
Yay! All right, Dr. Williams, tell me one more thing about you that everybody else needs to know before we meet you in April.
One more thing.
Yeah, one more thing. Okay, tell me a fun fact.
Fun fact.
Yes.
I'm an identical twin.
An identical twin. I'm a twin too, but not identical.
And he's also a chiropractor, but he practices in Connecticut.
Okay, so Connecticut, Indiana. Okay, all right. So if you're looking for Dr. Williams in Indiana, this is Dr. Michael Williams, not the Dr. Williams in Connecticut. Not too far though. If you need another doctor, what's his name? Matthew. So that's Matthew Williams, but this is Michael Williams. Well, I'm happy that you took the time to share a little bit more about your practice and even this addition to your practice, because if you don't want to do the StemWave just yet, you still can come in and get adjusted. We all need to get adjusted, even if you wasn't in an accident. As you get older, the joints are getting tighter. We need to get that mobility going. All right, so I will encourage you guys to come on by. Where are you located?
3725 Kentucky Avenue, southwest side of Indianapolis.
Yes. So if you come in downtown, you come southwest side. If you know Belmont Street, just come all the way down and then get into Kentucky. Or if you come off the highway on 465, just turn right, and about 2 traffic lights down, you could get in connection with Dr. Michael Williams. Thank you guys so much for listening in today, and I want to see you guys on April 18th, 2026. We are going to be there sharing information. We want you there to learn and even experience the things that can help you live better and have a healthy lifestyle all the time. We don't want you sick, so we want to see you there on April 18th. Bring a friend. We encourage you on that day to come on in, learn, take information with you. Bring your mother or your father, seniors out with you, because they're going to get information as well. And we are happy to help each and everyone. Do have a wonderful year, 2026, and help somebody today. If it's by a smile, a hug, or give them a visit with Dr. Michael Williams. This has been Michelle Bailey with FXWB New Beginnings Podcast. And today we've had Dr. Michael Williams with us. Thank you guys.
Happy New Year.
Happy New Year.